it to 50. The state of Texas is not gonna say you have to limit it to 50. You need to do what's best for your community. And I'll say this, the judges, the mayors, health department, Texas Division of Emergency Management, we are all in constant communication. Jimmy's probably tired of getting email from me all hours of day and night. But that's what we have to do. We have to work those extra hours to take care of everybody else. And hospitals, where's my docs and my hospital staff? I mean, you guys are working like crazy. The biggest thing I can say, calm down. Calm down, calm down, calm down. We don't make rational decisions when we panic. As long as we are calm and we look at the facts that are before us, we can walk right through this. People are going to get ill, okay? How many people are in this room? 80% of this room will get ill. You probably won't even know that you were sick, okay? The history has already told us that. So, keep calm. Like she said, don't go out and buy all the toilet paper. Okay? Well, yeah, you can't buy any toilet paper. I haven't figured that one out yet. Maybe Doc can help with that one. But it's about communication, and this is the right thing to do. This is the communication that has to go out, because each one of you is going to go out and tell somebody else. Word of mouth is the best advertising. It's a proven fact. So I think that this is fantastic that this many people are here. It's fantastic that you're going to go out and spread the word that, wait, we were all taught how to wash our hands from the time we were in kindergarten or before, right? Okay? How many times did we see our moms wipe down the counters? Okay? This is nothing new. Nothing new. We're just saying be a little bit more vigilant about it, do it a little bit more often, and we'll get through this. I do want to touch on one thing, Judge. For my elected officials and for my public safety responders, first responders. I know there is a concern about PPE, personal protective equipment. Take a deep breath, let it out slow, because we have received the authority to receive a portion of the Strategic National Stockpile. It has been approved by the President. We have received a piece of it. Now, with that said, EMS, law enforcement, you get a call. I'm sure the sheriff has a protocol in place for call takers whenever there's a medical call, certain questions they're going to ask. They're going to notify EMS, hey, you got a potential call of this type, so they can don PPE, personal protective equipment. The equipment that you have, like the N95 mask, under CDC guidelines, can be used more than once. Okay? Here again, traditionally, we use it one time and we throw it away. Under CDC guidelines, you can use certain pieces of personal protective equipment more than once. You can use expired personal protective equipment under their guidelines, but you have to read those guidelines and understand them. If you are running short on PPE, or you feel you are running short as a first responder organization, I'm looking at my medics back here and my law enforcement folks, you have to make an attempt, a reasonable attempt, to purchase those products, whether it's gowns, face shields, gloves, N95 masks. You have to make a reasonable attempt to purchase those items in your jurisdiction or through your normal vendor. If they do not have it, please get something in writing from them. Provide that to your emergency manager. He will in turn create a STAR, what we call a STAR, State of Texas Assistance Request, with that documentation and the items that you need, limited all the way down, or as detailed as how many boxes or how many cases of each item that you need. That will then come to me at the Disaster District in Victoria. We cover 7 counties, the ranking highway patrol lieutenant in this district and myself. And we will then review it for accuracy. We will send it to the State Operations Center. The State Operations Center will move it to the State Medical Operations Center. And if they have it, they will send it. If they don't, they will get it, and then they will send it. Okay? It will be prioritized based off of the number of cases in your particular area. Where's my hospital folks? Okay, if y'all have 6 people in your hospital, you're gonna get it before somebody else, most likely. Okay, that's just the way the numbers work. If there's a higher risk, they're gonna get it most likely before the guy that's only got 1. I'm here to tell you, just take a deep breath, relax. Lots of people are working many hours on this. I'm normally this sleepy, but I've been up since about 4:30 this morning, already working on this. So, any questions from anybody? Yes, ma'am. I didn't do it.
I know there are a lot of unknowns out there right now, but do we have a reasonable estimate of when we can expect to maybe be out from under this and have this passed? Are we looking at a month, 2 months?
I'm gonna flip a coin and I'm gonna pass that to her.
So, I'm not gonna lie to you, we're not really sure. The CDC thinks 8 weeks. That's what they put out. That's their guess. I mean, they're really smart guessers. So, they're really intelligent people, you know, making good assumptions, and that's what the most recent guidance says. Is they're hoping that 8 weeks will be the curve. The curve.
Do you know when 8 weeks started by chance?
Wow.
I'm not sure. I really don't know on that one, but I'm sure it's on their website. They released some guidance recently within the past 24 hours that has some data about that, and I haven't had a chance to review it. I apologize, I've been on the road.
So I will say this on that question. If you go to the CDC website and look at the statistics, globally, or through the World Health Organization, globally, you will see that the United States is about 20 times better than any other country in the United States. The question usually comes up, why? Because we are proactive, we pay attention to what's happening, and we try to jump ahead of that game. And that is exactly what we are doing here. Look at the other countries, look at the statistics, it'll show you we are well